Welcome back. You're watching The Globe. Now, the issue of immigration has caused tension between South Africa and other SADC countries, with government facing pressure from South Africans who are struggling to access services. A recent video and audio clip from the Limpopo MEC of Health, Dr. Phophi Ramathuba, and ANC National Chairperson Kennedy Mandaza are a clear indication that South Africa is experiencing huge challenges.
You speak Shona, and then how do you find yourself in Villa and when you are supposed to be with Unangago there? You know he doesn't give me money to operate you guys. And I'm operating with my limited budget.
Thank you so much.
Oh, well, you can't appreciate that. You're killing my health system. You are killing my health system. When you guys are sick, I'm hearing these days, you just say, let's cross Limpopo River. There's an MEC there who's running charity department. It's not.
The MEC of Health in Limpopo on a rant as her department struggled to provide health services to South Africans and foreign nationals. The MEC is not budging.
I do stand by its content because I need to give that understanding to say we are not doing anything to our surgical backlog because people are abusing, and that's what I was saying, that you are abusing the system. When they hear that the MEC is coming to this district with specialist care, they leave their country, enter South Africa illegal, come to our hospitals. The doctors who operate them, for ethical reasons, even though the Constitution will cover the doctors, but for ethical reasons, they don't refuse to operate them. But what is this thing doing is that that very same South African whom and the Limpopo citizen whom we did this project for, it's unable to get operated because they are still flooding even our initiatives. This is where the challenge is, because this is an initiative outside our daily work to say, let's be initiated and make sure we operate our people in the province.
But MEC,
we are not making a dent. If you were with me in the morning when we started with the first patient who was involved in an accident and was even proud to say, I got an accident in Harare, but I was told that there is a Dr. Phophi in the province who brings specialists in this rural hospital by my brother, who is, the brother is also illegal in the country. I came and get the operation. Those are the videos that will not be taken and trend.
Behind the scenes, similar frustrations from the ANC National Chairperson, Kennedy Mandaza, during this conversation.
You think about yourself, you don't think about the broader society and implications.
Is it an accusation or what?
I'm accusing you because you are shaking with anger. And I'm saying that anger is selfish.
Okay, so okay, thank you for being the judge of what anger is and who should be angry.
Yes. Yeah.
Yeah, and you hold a national position.
I hold a national position, and therefore I have a responsibility on my people. Okay.
And I'm not your people.
Forget about South Africans. Now listen, you want me to forget about South Africans and be absorbed into the plight of Zimbabweans? That is selfish, comrade.
The South African government has been lambasted for failing to take a tough position against the Zimbabwean government concerning the political and economic situation that has led to the citizens of Zimbabwe flocking to South Africa. SADC has also come under fire for failure to address the Zimbabwe question. On its part, the government of Zimbabwe has dismissed views that there is a crisis in that country. Zimbabwe will go to the polls next year, and the current political climate and criticism of the Electoral Commission in that country for political bias will continue to dominate the news. Phophi Ramathuba, SABC News, Johannesburg.
Well, for a little more on the Zimbabwe government's response to the viral video is Kennedy Mandaza, who's Zanu-PF's spokesperson in South Africa. A very good evening to you, Mr. Mandaza. What are your thoughts about what you saw on this viral video?
Thank you very much, Peter. I must start by saying that I don't speak on behalf of the government per se. I am a spokesperson for the ruling party, though. When I saw the video, which has been going or doing the round on various social media platforms, I think while the MEC could have addressed the issue elsewhere, in this regard, it is my view that she was insensitive to the plight of the patient who was seeking assistance. It is true, according to what she said, that she's given a budget for the people that are in her constituents. And it is also true that people are supposed to pay for the services that they get, those foreign nationals. But it is insensitive for an MEC to give a lecture under the circumstances that that lecture was given. There are other routes or ways that these issues could be raised. As much as she said that the patient needed to pay for the services that had been rendered to her, that is common cause. She could have been told by those that were giving her the service. But for an MEC to be insensitive in that nature and to throw away the ethics that she's supposed to follow as a doctor, I think it is something that is regrettable. And I think that could have been addressed in another fora in order to make sure that whatever she was saying could be sent home to those that are supposed to hear it, not the patient who needed assistance.
If we look at social media, perhaps anecdotally, it seems as if that she's received a lot of support from a good number of South Africans. What does that tell you about the sentiment of Zimbabwean migrants in South Africa and their access to South African facilities?
Well, South Africa is also grappling with its own challenges that have to do with the pressure that has been exerted on the resources, and among them are the health facilities, the resources that have to do with health facilities. And the sentiments that generally have been aired or the support that has been given, well, it is an expression of what we have been seeing over the last few months or so, that South Africa should take care or control of the migrants that are getting into the country, and those that are illegal should make sure that they leave the country, or they should regularize their stay in the country. So that it is not something that is new that we have seen this time around. It's something that we have been seeing for a very long, for the last few months, ever since the expiry of the ZEP permit. And also when we saw the decline or the deterioration in terms of the standard of living and the pressure that comes with the increase in the numbers in the country. So to a certain extent, there are genuine concerns that the South Africans are raising, but there are routes, there are ways and forums that can be used to make sure that these issues are attended or they are said to the people that are supposed to hear them.
How much responsibility does the Zanu-PF government take? Because a lot of these people are leaving Zimbabwe to come to South Africa for health care because they're just not getting what they need back home.
Well, Peter, you would understand very well that the Zanu-PF government is not naive to some of the challenges that it has seen over the years. and quite a number of reasons have been given. But it is also true that the Zimbabwean government under Zanu-PF at the moment has been doing quite a lot to make sure that it retains the conditions that are supposed to be there in education, in health, and to ensure that the living standard of the people of Zimbabwe are improved. So it is work that is currently taking place. Yes, we have had numerous problems. And for us to continue to labor on the reasons why we have had these challenges, I think we would be missing the mark. What we need to be looking at is what is it that we are doing to make sure that we address these concerns and to ensure that we have the facilities that we want in the country. And that is the work that the current government is battling with at the moment.
Millions, we believe, of Zimbabweans have left Zimbabwe to come to South Africa and other SADC countries because of the economic situation in the country. Is that contributing, do you think, to this challenged relationship between Zimbabwean migrants in SADC states?
To a certain extent, because we have always said that the challenges that we have had in Zimbabwe, for the reasons that we have said, and we will not continue to rehash them, they are known. And the migration of the people to the various countries has also put pressure on the resources in these countries. But we also need to commend those of the Zimbabwean nationals that are in the various countries, and they are adding to the economic activities that are coming in, that are taking place in these countries. It is not only that the countries are going to beg or get sick. Some of them are engaged in productive work that is aiding to the growth of the economies in which they are. So we need also to commend and look at these people that are legally in these countries and they are doing their work. But we understand as a country and as a government that we need to continue to work on what we are supposed to do as a government to make sure that the conditions that are in our country are such that they pull all the citizens that are out of the country back into the country to assist in the continued growth of Zimbabwe.
We've seen senior Zimbabwean government officials often traveling to South Africa and other parts of the world for medical care when the citizens have to put up with the care at home. How do you explain that to the Zimbabwean citizens and manage their desire to also get health care abroad?
I will start by saying that the movement of people from one country to another looking for medical attention is not unique to Zimbabwe. There are many other leaders in various countries that do so. When they see that in their countries they may not be having that particular service that they may be looking for, you may need to go to another country to look for that for that kind of attention that you require. But with regards to Zimbabwe, it is true that ever since the dawn of the 2000, we have seen a decline in the number of our systems and the facilities in the country. And it is for that reason that we have seen other countries with the resources becoming pulled or pulling people from their countries because of the pull factor that exists in those countries. We would want to have our leaders and the generality of the Zimbabwean population being attended in hospitals that are in Zimbabwe. That is why you have seen that over the years we have built a lot of hospitals, and what we need now to continue to do is to capacitate them with the facilities and the machinery which is needed in order to ensure that we have the kind of service that people require in hospitals.
Mr. Mandaza, we'll leave it there for tonight. Thank you so much indeed for joining us and sharing your thoughts with us on the program. All right, that's Zanu-PF spokesperson in South Africa speaking about this viral video with the Health MEC in Limpopo, speaking to a patient saying that Zimbabwean migrants, especially the ones that are not legal, have been putting a strain on the health system in this country, and that this needs to be addressed.